Hello, hi everyone. I just want to greet you again, and I'm here again to have a discussion with you and to share something as we started last time, the last video in the series. Remember, I told you we're gonna be doing some series of teaching and awareness, and we started last time, and the very last time, the very first one, the part one we caption as prevention of kidney problems, and that is the part one. And what we are talking about is the kidney care and conditions. Okay, so last time, if you go back to my previous video, you'll be able to get insight on what we discussed. So we're not going to deliberate so much on that. So let's go straight into what we are here today for. But before I do that, please, I just want to again appreciate each and every one of you that have subscribed to my channel and giving me thumbs up and commenting nicely and also sharing. Yes, I do get nice comments and I do try to respond as much as I can. Thank you so much. I don't take it for granted. Please continue to support me by, really subscribing to my channel. Again, I want to make a disclaimer. Please, I don't own any charity. I don't own any orphanage. I don't own anything whatsoever whereby I ask for donation of money or anything. Please, just in case, beware. If anybody is using my name or try to use my name or my name of my channel to ask for any donation, please know that it is not from me. It's not from Holistic Living with Stellaeziada. It's not from me at all. Thank you very much for your understanding. So part one of our kidney care and conditions today, we're going to talk about kidney diseases. We talked about prevention of, kidney problems as a whole last time. Today, we're going to deliberate on kidney diseases, the types, and what can cause them. And we continue from there. And I want to bring to your knowledge that I am a nurse. I've been a nurse for many, many years. For many, many years in my country of origin, for 16 years, and came over to UK and continued in the renal units, precisely kidney units, precisely dialysis unit for 22 years plus. So it's a long and vast experience I've got. And that's why I'm sharing, because a lot of people do not know what to do to prevent kidney problems, or what to do when they have some, issues that can cause to kidney failures and things like that. So we're bringing awareness for you to know, because knowledge is power and prevention is better than cure. Yes. So without taking much time again, we're going to go straight into it. But first and foremost today, as I said, I'm going to sort of reiterate a little bit about what do you know yourself about the function, what your kidney has to do in your body, what are the functions of the kidneys. Okay, let's look at it and go about it this way. So we bring out, so the work of these two organs in the body that do very wonderful job and know how to take care of them. Okay, and that is healthy kidneys. Healthy kidneys, number one, they keep a balance of body water and minerals such as sodium, potassium, phosphate, in the body. Keep them in balance so that they will not be less, that will not be more, as to start causing problem, to balance it up. That's the function, one of the functions of the kidney. Secondly, it removes the kidneys. Remember, we have two kidneys. And again, just to point this out, some people were born with one kidney. They may not even know until they might grow and get old and die without knowing they have only one kidney. And Fortunately for those people, the only one that is remaining for them function very well throughout their life. I know a friend who has only one kidney, and it was just realized when, at the age of 65, when he had problem. That was when it was discovered that it has only one kidney all the while. Still, it wasn't giving any problem. It just was in investigations, going around because of the problem she had. So the kidneys are two in the body. Okay, so they help to remove waste from the blood after digestion, muscle activities like exercises. When you do a lot of exercises and then the muscle releases some sorts of chemicals that should not be in the blood, the kidney helps to remove them. And exposure to chemicals or medications intake, the kidney also help to remove chemicals that are not supposed to be in the blood. That is, healthy kidney should be doing this. And then the third one, it makes a body chemical, which is normal body chemical, called renin, which the body uses to manage blood pressure. This renin is used by the body to manage blood pressure to be normal. The kidney is the one that makes this. The kidney is so very important. All the organs are very important. That's why they are called vital organs. Yes, very vital they are. And then the kidneys also produce chemicals named erythropoietin. This erythropoietin, it helps the body to produce red blood cells, and that's why we should always take care of our kidneys. A lot of people have this shortage in their body and they start having anemia, shortage of blood, and they may not know. And some people might be having kidney problem and they went into anemia and all sorts of things. That means there is not enough erythropoietin in the body to produce red blood cells. Functions of the kidney, very, very important. And then the fifth one, if I may say, is the kidney produce active form of vitamin D for healthy bone and other functions of the body. But still remember that we have extra acquisition of vitamin D from the sunshine. And that's why the early morning sunshine is so good for you to expose yourself if you can. Go out to the sun, expose yourself. Unlike the country where I live in, you hardly see sun. And when sun comes, oh my God, everybody's outside basking. Some people take off their shirts, take off their tops and whatever. You see them wearing even some only panties and things like that, just to get a lot of vitamin D. So very, very important. It's the kidney that produces the vital, the active one, apart from the one we get from the sunshine. And then the kidney filters all the blood in the body frequently, if not every 30 minutes, that it keeps on filtering. Very busy organ of the body, filtering it to make sure that by the nephrons, to make sure that your blood system is free of those chemicals that shouldn't be there. The urates, the chemical that the kidney should take out through urine so that you will not get problem with your body system. Again, now we're gonna go straight into the kidney disease. In the first instance, we have chronic kidney diseases and we have acute kidney diseases. But today we're gonna deal mainly on chronic acute diseases, which is called CDK in short form. Sorry, CKD rather. Chronic kidney disease, CKD. Yeah, and it says that this is a condition whereby the kidneys can filter toxins, okay, or extra fluid from the bloodstream as they should normally do. Okay, that is the chronic aspect of, kidney having problem, disease condition of the kidney. And this stage can vary in seriousness. It may not even be noticed. In most cases, it may not even be noticed. Some people have a chronic kidney disease, they may not have any symptoms, they might not have anything that is disturbing them as such, but is setting in anyway. Then some people experience it and they feel the symptoms and signs, all the elements of it comes on the people, on the person, you know what I mean. So the seriousness varies, from person to person, depending on how serious it is, at this chronic stage. But it can get worse over a period of time. Yeah, it can get worse over a period of time. Though treatment can slow down the disease from progressing. If treatment is initiated early enough, this can slow down the progress of kidney disease. If untreated, CKD can progress to kidney failure called end-stage renal failure, ESRD. ESRD, sorry, end-stage renal disease. Yes, end-stage renal disease, ESRD. So that is when CKD is not treated on time, it can now go further to cause the kidney to fail. And in this case, that's when the person starts noticing all signs and symptoms, which we will discuss at some point as well. Okay? And again, the most culprit of untreated or at this stage that can cause people to go into this end-stage renal disease is wrongly managed diabetes and high blood pressure. That's why these two culprits, high blood pressure and kidney diabetes, they are really two conditions that can really trigger kidney problems. And that's why, as I said, if you refer to my previous videos, you get a lot of knowledge there, what you should do to make sure if you're diabetic or if you have high blood pressure, what you should be doing to not allowing them to take you into further conditions like kidney failures and all the rest. Okay? And then secondly, you have what we call, we're now talking about causes, some causes. As I said, today we are talking about the causes, and then next time we're going to talk about signs and symptoms in some stage. We don't want to make this video too long, so that people will grab exactly what you are talking about. We talked about the CKD, the chronic kidney disease. Then the second one that can cause problem with the kidney is the polycystic kidney disease. We're talking about diseases of the kidney. The polycystic, and this is a genetic disorder. It runs in families. If any of the parents, especially if it's a mother, mothers pass this on easily to their children, especially to their male children. We don't know why. Nature has a way of doing things, which is not others. But research has shown that these are how it been noticed and been going. And that is it. It runs in family. It's from gene. It's a genetic factor, and this cause it makes the cyst. It forms a little, sort of fluid. The sac it formed in the kidneys will be a lot of cysts. Little sacs that filled with fluid. And this fluid, they grow on the kidneys. They grow around the kidneys, thereby limiting the ability to filter waste from the blood. You see? So there are a lot of things that can cause the kidney to have problems. That's why we're bringing awareness. So again, I'm going to just be chipping in something, reminding you of what I have talked before. It's good to go for a checkup to know something and be able to, if something is kicking off, so that you'll be able to manage it on time before it goes into a situation where you can do nothing. And then we have what we call the lupus nephritis. And this is an autoimmune disease. And in this case, the body immune system attacks the healthy cells. the kidneys now struggle to filter, waste from the body. The immune system of the body, you know, is now being attacked by itself. The system is now attacking itself, and then it's autoimmune. It's within yourself, your body, and that immunity in your body, that autoimmune attack of the system now begin to attack the normal cells, and the kidneys affect, it affect the kidneys more than anything else. And then the kidney will start to struggle to, filter out the rubbish from the bloodstream. And then in the fourth one, we can talk about the cause of kidney disease is what we call the interstitial nephritis. And this is a situation where there is bad reactions to medicine. There's some medications or medicine you will take and the body will react badly, adverse reaction. The body will react badly, and will also limit the kidney from filtering the toxins from the blood because of the excessive reaction. And when this reaction happens, the body exhibits or releases a lot of toxins that is dangerous, very risky to the body, and it triggers it that the kidney will now struggle so much that the kidney will now struggle to, remove those toxins. However, if the medicine is noted and discontinued, in this case, a lot of time, it improves the kidney disease at that point, and there'll be healing, if it is, the medicine is noted and discontinued. The important thing is to know, especially people who are on too many medications, the important thing is to know which one is causing the problem, which one has triggered, the reactions that are so adverse. So as we're saying, if it is discontinued, there'll be improvement in the kidney disease of being caused by interstitial nephritis. Okay, and then the fifth one we're going to talk about here is the glomerulonephritis or glomerular disease. There are thousands and millions of little tiny, tiny filters like mesh, network mesh in the kidney, very tiny. It's just like spongy, but very, very tiny. You can only see them with, microscope or so, So when they are damaged, when they are, infected, with infection or something gone wrong there, and then the kidney will start to have problem because there is distortion in the flow of blood and the work there to do. The nephron has been damaged. They are no more free to absorb fluid and to give it out for the body, for the kidney to take out through urine. And this condition, it damages it because the network and the spongy air network is now damaged. The kidney function will not be as well as it should be. And in this case, it is also noted that because it's infection, the most common infection that causes this glomerulonephritis is usually streptococcal infection. Streptococcus infection, which is a bacteria, and it is when one notice that you have urinary infection, maybe you have been having urgency, you have been having frequency, you have been having pain while you're urinating, you are having fever, you don't take those things for jokes. Go for checkup, go for urine tests, go for blood tests, because it can be found through blood tests, So mostly in urine tests, cultures and all those things, So when it is really treated, then the glomerular will be better. Glomeruli will now be better and well healed if it's not affected, so much that the damage so much that the kidney might start failing. And this infection is not really so good to the kidney. It distorts it and it disturbs it from doing its function very well. And then the sixth one we're gonna talk about is what we call APOL1. This is another gene. It's another gene in the body, and this one is when it's called the APOL mediated kidney. Number one. Yeah, and this helps to make immune system protein. But the thing is, however, if it's mutated, when it's doubled, when not even double, when it's mutation, when things start multiplying in excess and start changing the normal format it should be so as to function well, it's like a body being normal skin body, and all of a sudden the body, a particular place develop like something like boil and something like that. Of course, it distort that the normal growth of the skin or the system or the tissues around it, and then there will be problem. That's exactly how this works. And if this mutation now gene is the condition happens, the kidney starts struggling. And moreover, this is mostly inherited from both parents. There's a risk here, for the mutation to go on. It's inherited from both parents. For this APOL1 gene to start getting into problem, mutation, and then forming problem, causing problem for the kidney to function well. Again, we have the what we call what it says, who are the prevalent people that suffer from this APOL1 situation. It says it's common and commonly identified in Black people, Black Americans, and African Americans, yeah, Afro Caribbeans, and the Latinos and the Latinas. So those group of people are mostly affected. That's where this APOL1 is really found, that causes kidney problem disease. Okay, then we have the long-lasting viral diseases. Long-lasting viral diseases, of course, we know the culprit, like the HIV and the AIDS, hepatitis B and C, hepatitis B, hepatitis C, HIV and AIDS, which lasts so much long in the body system and so difficult to treat, so they go to destroy the kidney, and then the kidney will start having problem. Okay, and that is how the kidney can also start having disease due to this long-lasting viral diseases. Very, very dangerous. And then we have what is called the pyelonephritis. The pyelonephritis is as a result of urinary tract infection, UTI. When one start getting infection, we can result in scar formations in the kidneys as the infection heals. If the infection stops, then the kidney will start having scars. Like, take it like somebody has a cut, or maybe a boil again or something, and then when it heals, you can see that skin here there will never be the same. It forms scar tissue, and this scar tissue now made it so difficult for the kidney to function very well due to the infection. And please, as I said before, in this instance, you also experience that something is not wrong with the way you wee. It might be stop and drop, like in men. It can be stop and drop, and don't confuse it. Sometimes prostate enlargement can cause those things. Then infection can also cause it. It can be urgency. You want to you want to urinate. Before you know it is coming already, and then you want to urinate. It's painful. Please go for a checkup immediately. Don't even waste time or start messing about trying to drink this or drink that or do all those self-medication a lot of people do, go over the counter. Please, I'm having this. Can you mix this for me? Mix that for me. Please, let's take good care of our lives and our body and help the kidney, please, to function well. And this particular pyelonephritis, it can damage, the kidney. And it's worse when it starts getting repeated. When you start, every time you're having infection, every time you're having infection, every time you're having urine infection, and you don't care. And then, if you're a man, you pass it on to your woman. Or if you're a woman, you pass it on to your man. And then all of you will be having similar problems. It's not good. If nothing else for you to go and treat yourself quickly, just you don't want to pass it to your husband or your wife, please, let's take care of ourselves. I'm just bringing this awareness for those of you who may not know to know. Even some people know but don't want to take action. Please, I'm begging you. I am really begging you. I'm talking from experience. It's so painful when you see people coming for dialysis, and then when their history is taken, you find out that what led them to have their kidney fail is something they could have prevented. Is something they could have worked on, and end up not coming to dialysis. Because dialysis, I always say it. If you go back to some of my videos, I always say it is such a frustrating thing. It's not easy for one to be in hospital 3-4 times a week. It is not easy, and it is not even affordable in so many countries. Some people cannot even afford to dialyze. And then you see somebody having kidney problem, they can't even afford anything. Like, even in I'm saying it, and from the country where I come from, a lot of people, I mean a lot of millions and millions of people cannot afford dialysis. And that's why people are dying so much with kidney failures and problems of the kidneys. And that is why it's really in my heart to help by bringing awareness. Please, our people, make sure you, especially when it comes to infection of urine, and when you are doing things, whatever you're doing, you're having your shower, you're having your bath, you're even urinating, take care of yourself. Do it in a hygienic way. Don't mess about. Don't use things anyhow. Don't just clean yourself anyhow. Anyway, this will be a topic for another day. I will talk about general hygiene one of the days, the right ways to do things. And these are small things we can do to prevent ourselves from having problems of this and that. So today, as we talk about these kidney conditions, diseases, please listen to this video over and over and pick some points that can be of help. Even if it's not you, it can be of help to somebody. You can advise somebody. You can pass the message to somebody. You can use it to save somebody's situation. Yes, you can. It's not about you listening to me or watching this video. Please pass on this, share it out, share it viral, let it go viral. Let people learn. Let people be aware of what they should do. So in any case, as at today, we're gonna stop here in this our part 2 of our series of our kidney care and conditions. So this is series 1, if we can call it that way, or series 2 today. This is part 2. So the next time we're gonna go into part 3. So we're gonna talk about, we're still on the kidney care and condition, remember. So next time we're gonna talk about 2 major types of kidney problems, kidney diseases. Okay? Thank you so much. For now, I will say, please, don't forget to subscribe to my channel. Don't forget to do that. And show me a thumb up and make a comment. Ask questions. If you have any question, put in the comment section. I do go through my comment sections. I will give an answer, and you can go back there and get it. Please, if you're confused, because nobody knows it all. Sometimes you might think, oh, I think I've heard this several times. But have you heard it in this dimension? Have you heard it in a simple way where you can grab something that you can run with? You know? Have you heard it in a way that it is explained to you in a layman's language where you can understand it? It's not where you go into hospital, you'll be hearing too many grammars, because when it comes to diagnosis and something like that, when it's given a name like that, like all these pyelonephritis, glomerulonephritis, this and that, you don't know what it is. But bringing awareness, trying to let you know what these things are and what you should expect in anyone if those big grammars are being told to you, especially by our wonderful doctors. Yeah. Okay. So please share this video, subscribe. Again, I want to use this opportunity once again to thank those who have already subscribed to my channel. I want to say God bless you all, and keep learning and keep looking after yourself. For now, I will say goodbye till when we get to part 3 of this particular series. Thank you, and God bless you.